Great, thank you. Thanks, Elaine, and thank you, everyone, for being here. I'm really pleased to see such a good turnout, and I apologize to those of you who are standing in the back. I hope that the hour is not interminable for you. Now, the reason for today's talk, as Elaine already said, is that I'm going to talk with you about the role of mixed method research in pragmatic trials and in dissemination and implementation, but particularly implementation research. This research, as you know, is focused on real-world applications of interventions that have generally been shown to be efficacious under artificial, often ideal conditions. And my argument, the reason I'm here today and the reason I structured this talk in this way, is that an understanding of the critical role of context in implementation is necessary, and that mixed method studies are best suited to provide this. Because a given intervention may succeed in one situation and fail in another, quantitative data about effectiveness should not stand alone without an understanding of the impact of context on the results. And similarly, of course, qualitative data alone, without the breadth provided by quantitative data, are likely to provide limited insight. So I hope to convince you today that it is in the combination of strengths of different types of data that the fullest understanding can be achieved, and of course to give you some pointers about how to combine methods successfully. Sorry, yeah, there we go. So today's agenda, as you can see, it's quite ambitious, but I assure you we're only going to cover these things fairly briefly. We're going to start off with a definition of terms. I want to make sure that we're all clear about what I'm talking about when I say pragmatic trials and dissemination and implementation specifically. I'll then talk briefly about the current and recent use of mixed method studies in health services research in particular. I'll speak briefly about the different strengths and purposes for qualitative and quantitative data, and then move from there into a discussion of what I call the 3 dimensions of methodological combination. And it's these that I want you to think particularly carefully about as you are hopefully designing your own mixed method studies and moving forward in this field. We'll then talk about 5 mixed method designs in particular that have relevance for dissemination and implementation research. We'll talk about some common barriers to using mixed method approaches, and then we'll end with some suggestions for better integrating the publication of mixed methods research. Now, there are several new terms, as I'm sure you all are aware, in recent years that were designed to more specifically characterize research that had been previously classified as health services or outcomes research very broadly. Terms like pragmatic trials and dissemination and implementation science in particular reflect a recent focus on increasing the relevance of research to changing practice and policy in order to improve health and health equity. Pragmatic trials, of course, are designed to determine the effects of an intervention under the usual conditions in which it will be applied. And that's in stark contrast to the highly controlled conditions, or often highly controlled conditions, of a classical efficacy trial. Now, there's still considerable variation in how dissemination and implementation research is defined, though, in contrast to pragmatic trial. And that's particularly so within the field of healthcare. And that's because dissemination and implementation research as a term, or science as a term, is relatively new still to the field of health. It has a history of different disciplinary backgrounds and philosophical traditions behind it. But for my purposes today, I'm going to use the following definitions. For implementation research, I'll be taking Rubenstein and Pugh's definition as scientific investigations that support movement of evidence-based effective healthcare approaches from the clinical knowledge base into routine use. And as I said before, that's where my emphasis will be in this particular talk. And dissemination research, I'll be borrowing from Glasgow and his colleagues at NIH, the targeted distribution of information and intervention materials to a specific public health or clinical practice audience. Now, as I mentioned a minute ago, the reason I'm focusing on pragmatic trials and dissemination and implementation research, although particularly implementation here, is not only because of their rising importance in the field, but it's also because I believe that employing mixed methods should be common practice in this type of research. I'll certainly acknowledge the many barriers, and we'll talk about that a little bit later, but I think all efforts should be made that to put mixed methods into practice with this type of research in particular. And that's because understanding the context in which interventions are implemented is imperative for effective pragmatic trials and dissemination and implementation research. We have to understand the why behind the success and failure of intervention implementation. And the use of mixed methods is particularly helpful in this quest to understand context, in part, for many reasons, but in part because they generate data that are deep as well as broad, and thus taken together can help us piece together throughout the heterogeneity of multiple trials what is really going on and what seem to be the common denominators, the common factors about what works. Now, in recent years, there's been an increase in studies using mixed methods in health services and primary care research, among others. There's been a particularly growing number of studies that have been prevention-oriented that have used mixed methods. These are particularly so in studies about weight loss and active living, immunizations, cancer screening, osteoporosis, cardiovascular health, and substance abuse prevention. But there are still too few studies to help researchers interpret and understand the significant heterogeneity of these trial results. There have been numerous studies that have followed the paucity of mixed method studies in this field, but one very recent study by Wisdom and colleagues found that only 47 of the more than 1,600 empirical articles published in 4 top-ranked health services journals used mixed methods. I think we can all agree that that's pretty limited. And even more concerning, arguably, is that the reporting of key methodological components remains uneven, even now. And in particular, the description and results of the qualitative methods used has varied significantly. And that's a problem, again, because if we were to recreate what's really working, what's really going on at the base of this, ultimately at the end of these trials, we need to understand exactly what was done. The reporting has to be clear and full. So this is a problem if such methodological components are not reported fully, particularly the qualitative. Now, it probably escapes no one in this room that quantitative methods have an emphasis on deduction, objectivity, and generalization. And those emphases are useful, very useful, when measuring intervention and or implementation outcomes. Quantitative methods typically involve testing and confirming hypotheses based on existing conceptual models, and then obtaining a breadth rather than a depth of understanding of the predictors of successful implementation. So all that's well and good. Clearly, no one would argue that that is unimportant to any kind of research that we would want to do in the health services field. In contrast, qualitative methods, a relatively new type of method on the block here, qualitative methods are used to address aspects of a topic that are intensive, nonlinear, and may require interaction for fullest understanding. We can see this in particular with the study of processes. Studying process requires deep and careful observation of dynamic patterns of engagement so that not only the nuances in, but also the meaning behind patterns are emergent. And again, this is very important to piecing it all together. The qualitative methods also offer an inductive contextual approach that are particularly useful for eliciting perspectives and values and opinions about stakeholders or participants or consumers in their own words. And again, this is crucial if we're to understand what's actually going on. This kind of approach is also useful when seeking to understand why evidence-based practices are unsuccessfully implemented or, of course, successfully implemented. And it's also useful when seeking to identify strategies for facilitating implementation. Because of these different strengths and these different emphases, there's a fair number of common methodological combinations. And I want to mention these briefly here. People often use quantitative data to study outcomes, while they use qualitative data to study processes. Somewhat similarly, quantitative data to measure aspects of substantive content, and qualitative data to understand the context. Or often, qualitative data may be used to explore a phenomenon and generate a conceptual model and hypotheses, and then using quantitative data to test the hypotheses to confirm the validity of the model. These are some of the common methodological combinations that we frequently see in mixed methods. But you don't just slap these things together, and this is something that I think is missing a little bit as we move toward more mixed methods. You don't just slap these together. You have to have some thought behind the way that you integrate the data. So the key to strong mixed methods research lies in the effective integration of the methods used. Combining and capitalizing on different methodological strengths allows researchers to increase both breadth and depth of understanding, certainly. But effective integration is more than just collecting and then reporting these two or more sets of results. And again, this is something that we see missing quite a bit in some of the mixed methods research that is published out there. Data need to be mixed at some stage, and researchers have to be clear about the implications of their choices, particularly regarding the nature and the timing of the integration. A quote I particularly like describing this by Creswell is that the underlying logic of mixing is that neither quantitative nor qualitative methods are sufficient in themselves to capture the trends and the details of the situation. When used in combination, both quantitative and qualitative data yield a more complete analysis, and they complement each other. So that's what we're going for. We're going for thoughtful integration, thoughtful use of whatever kinds of methods that you're using, right? That should be standard. But in this new kind of way, this new era of employing mixed methods, or at least being interested in mixed methods, people haven't quite gotten this down yet. And I think this is a very crucial point. So the literature identifies three main opportunities for integration. The first is what they call merging the data. And merging the data occurs in the analytic phase only when two types of data are brought together to answer the same question or related questions, where you're sort of triangulating the different approaches. Connecting the data occurs when the analysis of one set of data, for example, let's say quantitative, leads to the need for and subsequent collection of another set of data, let's say qualitative, right? This happens fairly frequently. You get tons of different patterns and results emergent from the quantitative data, and you want to know more. You want to know that why that I brought up before that should be driving your investigation in the first place. There's also embedding the data, and that occurs when qualitative studies of implementation process or content may be embedded within larger quantitative studies of outcomes in order to obtain depth or expansion. Now, there are some cases, I'm saying this as the qualitative data is embedded within quantitative data. I should offer the caveat that sometimes it's reversed. Sometimes quantitative data can be embedded within qualitative data, but as you can imagine, the N is much smaller when you do that, and thus the effect of using quantitative data can be much more limited. Now, of course, the key to good mixed methods research is to be thinking through how the data are or could be related throughout both the study design and the analysis phases, right? Again, we want to be conscious about how we're combining these things, how we expect them to relate to each other, and then later on, how they actually did relate to each other. So in both study design and analysis, researchers need to understand and be able to make explicit the rationale for what I call the three dimensions of methodological combination. And those are order and sequencing, priority, and purpose. And of course, when I say purpose, I mean both for each of the specific methods used, right? It's not enough just to say, well, we used one quantitative and one qualitative, right? Of course, that's not it. There's a variety of different approaches, both within quantitative approaches and qualitative approaches. And also for the particular combination that you use, right? There's going to be thought behind all of this stuff. So let me say a few words about each of these combination dimensions. Methods may be used, certainly, either simultaneously or sequentially. I think that's fairly straightforward, right? You either do the collect the data at the same time, or you do one before the other. But when they're used sequentially, there are a couple of terms that you may want to know about. When one method is used to answer questions that emerged following the data collection using another method, that's called either expansion or explanation. Qualitative methods also may be used to generate initial data that will enable the effective use of other methods, and that's called development. And certainly in implementation science, this kind of generative work may contribute to instrument development, conceptual development, or intervention development. And then finally, when one method is used to identify a sample of participants that will be used by another method, that is, of course, called, to the surprise of no one probably, sampling. Now let me say a little bit about priority. One method in dissemination and implementation work in pragmatic trials is typically operationalized as the dominant or primary method, while the other is subordinate or secondary. And most dissemination and implementation studies to date have treated quantitative methods as the primary method because assessing the process of implementation is viewed as secondary to evaluating the effectiveness of intervention outcomes. And that certainly makes sense. Of course, it depends on your ultimate goal, but if that is the goal, then that does make sense, right? But the two types are often given weight, or the same weight, when evaluating fidelity and assessing implementation barriers and facilitators. So again, you want to be thoughtful about and conscious of the reason that you are doing the research in the first place, right? It sounds like a sort of elementary 101 kind of approach, reminder, but certainly I'm sure we're all aware that it doesn't always happen that way. And sometimes different methodological components are sort of slapped on at some random stage in the process, and so that's not ideal. In terms of purpose, different methods, of course, may be used to answer the same question, which is known as convergence, or to answer related questions, which is described as complementarity. Convergence may occur in one of two forms. Triangulation involves the use of one type of data to confirm conclusions reached from the analysis of second type of data. And transformation involves, first, the sequential quantification of qualitative data, or second, the use of qualitative techniques in order to transform quantitative data. And by saying first and second there, I didn't mean to imply that one took priority over the other, just to differentiate the two and to make it clear that you can transform both qualitative data into quantitative and quantitative data into qualitative, provided that your data themselves are broad enough to do that. Now, Creswell, who is one of the leaders in the field in terms of mixed methods, particularly for implementation science, has identified several mixed methods designs that are important to talk about here. And I'm going to cover 5 that have particular relevance for dissemination and implementation research. We can talk about the others if you're interested later, but these are the ones that have relevance for D&I work. I'll talk briefly about the convergent parallel design, the explanatory sequential design, the exploratory sequential design, the embedded design, and the multi-phase design. And I'm going to describe each of these briefly, but while I do so, I'd like you just to think about how each of these combines the different dimensions that we just discussed. You can see that they do it differently for different purposes, and I think, depending on your question, they are equally effective. So the convergent parallel design involves the simultaneous collection of quantitative and qualitative data, and then involves merging the two types together. One example by Liddy and colleagues, was published last year, was a pragmatic trial to improve the delivery of evidence-based care for the prevention and management of cardiovascular disease in primary care practices using practice facilitation. The study included quantitative analyses of large data sets, analyses of pre- and post-intervention chart reviews, and narrative reports, qualitative reports, of facilitation activities and barriers to change within the practice. And then following data collection, all these data were triangulated to determine factors involving practices' strategies for change. Now, I want you to note that for each of these designs, I'm going to give you an example. And on your slides, you have some references at the very end. So each of these examples is included in the references. So I encourage you, if you're interested or want to learn more about any of these particular designs, that you check out these examples, because they're very solid examples and can be quite educational, I think, to look at. Now, next we turn to the explanatory sequential design. And this involves 2 sequential phases. First, quantitative data are collected, and then qualitative data are collected in order to help explain the quantitative data. Another example, Warner and colleagues, in a study published in 2010, evaluated a workshop that was designed to increase practitioner awareness of best practice recommendations for secondary stroke prevention and identify barriers to implementation in rural practices. During and after the workshop, survey data were collected to evaluate the program, and then follow-up interviews were conducted in order to provide opinions of the workshop and explore emergent patterns in the survey results. This is a classic, example of an explanatory sequential design. They wanted to know more and further develop what they found in the survey results. Now, the exploratory sequential design also involves 2 sequential phases, but in the opposite order. Here, qualitative data are collected first, followed by the collection of quantitative data in order to help explain and provide breadth for the relationships that emerged from the qualitative data. So in this example by Sussman and colleagues, there was a study that examined clinicians' perceptions about delivering preventive counseling in a brief primary care encounter. And Sussman and colleagues first conducted individual in-depth interviews with clinicians. Then they facilitated clinician focus groups in order to refine preliminary interpretations. Let me just pause here and note that for anybody keeping track, that's two different qualitative methods that they used, right? Interviews and then focus groups. And then they mailed the clinicians a survey questionnaire to determine frequencies of agreement with factors that were identified during the qualitative data collection. A fourth design type here that Creswell has identified is the embedded design. And you'll remember that I mentioned embeddedness a little bit earlier. So embedded designs involve data collection that can be either concurrent or sequential. But the key is that one form of data needs to be embedded within the other form, and thus one form is more supportive of the other. So again, this example by Puchel and Thompson, engaged in this study to better understand the lack of compliance with mammography screening and design intervention strategies. So what they did, they first interviewed women about the facilitators and barriers to getting a mammogram. Then they used those data to design a randomized control trial addressing the barriers and facilitators identified. So you see how that's embedded right there. The data that they collected were then embedded in the other approach. The fifth and final design that I'm going to talk about here very briefly is the multi-phase design. And this involves a series of phases or separate studies, each of which may use a combination of sequential and or concurrent phases. Right? So essentially, it's just complicated. It's very busy and complicated. But I should note that there's a recent increase in very innovative implementation research using multi-phase designs, including those incorporating unusual combinations of methods. For instance, longitudinal quantitative data combined with longitudinal qualitative data, discourse analysis with survey data, secondary analysis of data sets with qualitative follow-ups. And you can see an example of this kind of innovative research in a recent publication by Scott and colleagues. And they were focused on the development and evaluation of an education program for healthcare professionals and community leaders on how to design, implement, and evaluate a fall prevention program. And so their approach included a lot of different things. It included a needs assessment, systematic reviews, pre- and post-test of learning, follow-up surveys and interviews, and descriptive reports of stakeholder involvement. So they had a series of sort of, you can think of them as either phases or separate studies, but all of them were devoted to the idea of ultimately answering one question, which is, of course, why it counts as one study. And as I said, this is a really exciting kind of growth area in terms of mixed methods research. There's a lot of different things going on, and I'm happy to provide you a number of references if you're interested in following up that later. So despite this innovative sort of recent increase in innovative approaches, both with mixed methods in general, but also with multi-phase designs in particular, despite this, overall mixed method studies are still relatively few and far between, as I mentioned at the very beginning. So why are mixed methods not more commonly implemented in pragmatic trials and in dissemination and implementation research? I'm going to highlight here what I think are the leading reasons. Of course, there's probably many others, but I think these are the key ones. The first one is that there is, as probably all of us are familiar with, there's a lot of difficulty often in gathering and or accessing data that are nonlinear or time or interaction intensive. And again, we go back to what I mentioned before about process data. As we know, process data can be incredibly helpful to understanding how and why things are implemented in the way that they are, and whether they were successfully or unsuccessfully implemented. But there's so many barriers that are associated with this. So a number of challenges. We have particularly perhaps the constraints that are very obvious on both funding and time. It's often quite hard to have the adequate number or adequate amount of resources that you need, particularly when we're on short grant cycles, relatively short grant cycles, that can be a real barrier to this. There's also, though, the siloization of methodological expertise that, again, may not be that shocking to any of us here in this room. Most researchers have been trained primarily in either qualitative or quantitative methods. And in health services research in particular, a field in which researchers have been typically trained in the medical model, there is a relative dearth of training in, or sometimes even exposure to, qualitative methods. And this is compounded by relatively few opportunities for true collaboration with social scientists or others who may be more familiar with qualitative methods. Certainly, many places now are trying to address and fill in the gaps here and have forums for methodological exchange. Certainly, we're trying to do that here at Coho and Core, where, as Elaine mentioned, there is and Chris as well, where there is a particular emphasis, a conscious emphasis in trying to bring qualitative methods some attention as well, so that we can effectively pair qualitative methods with quantitative methods. So those are a couple barriers there. But there are also barriers to publishing the results of mixed method studies. And this is something that many of us have run into, and it's been very frustrating. At the writing stage, authors are often stymied by word limits that are required by most journals, which typically constrain discussion of both methods as well as how they fit together, right? It's very difficult to get really into the nitty-gritty about how everything went and how everything was conducted and reporting those key methodological components when you have, at best, 4,000 words to work with, right? Very difficult. Because, of course, you don't want to just talk about the methods all the time either, right? You want to be able to actually explain what happened. So that's at the writing stage. At the review stage, editors don't always select appropriate reviewers who can interpret and appreciate both qualitative and quantitative methods. And that can often be a big roadblock to people trying to submit manuscripts. And similarly, at the review stage, there's a lack of consensus often about reporting standards in mixed method reviews, which makes quality difficult to assess. So you have often, for any of us who have tried to publish mixed methods results, you can often run into this big roadblock where one reviewer will be clearly partial to one set of methods, and and it's very discouraging and very difficult to be able to really address both types of methods, and even more importantly, how they all work together. So certainly those are formidable barriers, but even if a mixed method article makes it through those barriers, and of course many, many do, there are still limitations in how effectively the results will be disseminated. And I want to talk about that for a second here. Results of mixed method studies are often segregated in different publications that reach limited and often non-clinical audiences. So Stange and colleagues suggest 5 ways to better integrate the publication of mixed methods research. And I want to share those with you today because I think they can be instructive for many of us in this room. They basically break down into 5 different suggestions, 4 of which have to do with publication in particular, and 1 of which goes beyond that. So they suggest first to continue to publish, or one option at least, is to continue to publish quantitative and qualitative results in separate journals, as is typically done now, certainly, but with improved connection between the articles. So in their view, each article should prominently cite the other, linking the 2 articles very clearly, so that the disparate audiences that are typically served by each journal can easily search out more information about the variety of methods used in the larger study, right? That's very important. A second option that they mention is to publish concurrent or sequential quantitative and qualitative articles in the same journal. This is something that I don't see very frequently, but it's certainly something I think on the rise, and more editors are open at least to the suggestion if we propose that. So in this option, articles should still reference each other, and each discussion should contextualize one article's findings in relation to the others. But publishing in the same journal would make it easier, far easier, for the reader to understand how the articles fit together. And remember here, I hope you've noticed this throughout everything that I've had to say so far. Remember that the idea here, the underlying idea, is not just saying we did this and we did this, right? Checking off different boxes, especially to appeal to increased interest by funding agencies or by, in some cases, reviewers, to have multi-method approaches. It's to really understand how all these things go together, right? It's not just to say we did a quantitative method and we did a qualitative method and aren't we advanced. It's to say that, or to take these 2 methods or more methods and really put them in service to each other, right? We're trying to understand both the how and the why. And one method is typically, or at least let's say the what and the why. And one method is more typically more friendly towards one, the what, and another method, the qualitative method, is typically more friendly to answer the why. So we want to be able to, have this relationship between the what or the how and the why, so that we can understand what's ultimately going on in the heterogeneity of the trial results, so that we can make sense and actually be able to translate the research, bench research that's being done, into effective real-world applications. So I say that because I want just again to emphasize when I'm talking about the second option here, as well as all the other options, that just publishing your results in some cases doesn't go far enough to answer the deeper questions about how they all relate. And so doing option 2, for example, having them easily accessible within one journal can go a little bit farther to helping to address the larger, more holistic kind of question that you're after. Of course, another way to do that is the third option that they talked about, and that is to publish an integrated single article in which all the methods are described and all the findings of the study are described. And this is certainly, by one measure, the easiest and most straightforward way for readers to access and understand a mixed method approach and the breadth and the depth of finding that such an approach allows. But as we alluded to before, it's likely to be much more lengthy. And so one way around this length dilemma is perhaps to describe the main methods and findings in a succinct manuscript and then provide additional detail in one or more appendices. Now again, this is something that not all journals allow, but this is something that's worth discussing with an editor during the review process, because it may in fact be agreed upon, and it may in fact go a long way to not only helping to get all of the details out there, but to really help the reader understand how, the depth of the methods that you used, so that they can learn from that and perhaps recreate it in their own studies. A fourth option, which of course is a lot of work, but may also be attractive to some of us, is to try to publish 3 articles. Again, these are the suggestions that Stangi and colleagues have made. So they suggest publishing not only separate qualitative and quantitative articles as an option, but also a third article that draws overarching lessons from analyses across the multiple methods used, and can thus engage more deeply with the connections between the data. And as I said a minute ago, that's what we're after here. We want to understand how the data relate to each other so that we can make sense of them. And then finally, the non-publication option that Stangi and colleagues suggest is to develop an online discussion of readers and invited commentators to foster cross-disciplinary communities of knowledge following the publication of relevant methodological and substantive articles. This is, again, not a publication option, but an innovative way they suggest to better integrate mixed methods results and improve knowledge. Now, I think we can all probably imagine that that could be both extremely promising and also not useful at all, depending on who actually chooses to engage in that. So that's something that probably bears a lot more experimentation and practice. But it's certainly a nice idea to try to think outside the box of how these kind of results, these mixed method studies, can be expanded and can be more easily accessible to a variety of people who aren't just necessarily searching in PubMed for a given abstract to read. So with all that said, I just want to conclude by emphasizing that the importance of pragmatic trials and dissemination and implementation research in guiding efforts to improve healthcare delivery and population health is increasingly recognized. This is clearly, in my view at least, the wave of the future. This is what it's about, because we're interested in translating research in a way that makes it accessible and relatable to real-world applications. And this kind of research is focused on real-world applications of interventions that have generally been shown to be efficacious, as I said before, under artificial, often ideal conditions. And therefore, an understanding of the critical role of context in implementation is necessary. And because a given intervention might succeed in one situation and fail in another, quantitative data about effectiveness should not stand alone without an understanding of the impact of context on the results. And similarly, as I said before, qualitative data alone, without the breadth provided by quantitative data, are likely to provide limited insight. So it's in the combination of strengths of different types of data that the fullest understanding of whatever you're studying can really be achieved, and thus improving the translation of research to real-world settings. So with that, I'll close, and I welcome a discussion of, as Elaine said earlier, of anything, of your experiences with mixed methods, any questions on what I've said today. This talk was designed to introduce you to how to start thinking about mixed methods, to provide you with some key dimensions that are important in methodological combination, and to provide you with some very common and attractive, I think, design typologies that you could maybe consider for your own research. I also want to encourage you to contact me if you have any other questions that come up after this talk is over. And I also, please contact me too if you'd be interested in finding out more information about the Qualitative Research Methods Forum, which is a group that I direct here at the Anschutz Medical Campus, although it's open to people who are not on the Anschutz campus as well. And our mission is to basically further develop qualitative methods, but also to integrate, to think about how to integrate qualitative work within other quantitative studies as well. So we have a website. I'm happy to direct you to that if you want to get in touch. And I'm happy to, I guess, turn it over and answer any questions that anyone has. Thank you. Any burning questions? Yes.